Bismillah ar-Rahman ar-Rahim. The paper is outcome of selective root canal retreatment. It is a retrospective study published in International Endodontic Journal by Martin et al. 2022. The goal of this retrospective study was to evaluate the clinical and radiographic periapical radiograph or CBCT outcome of selective root canal retreatment after 12-month follow-up, and also to evaluate the assessed periapical status of untreated root with no apical periodontitis in initial diagnosis, and finally to assess the tooth survival. Moving to material and method, all non-surgical root canal retreatment of multi-rooted teeth performed within 4 years. The clinical and radiographic record of each patient were reviewed, and eligibility for the study was assessed based on an inclusion and exclusion criteria. The inclusion criteria were follow: multi-rooted teeth, clinical diagnosis of symptomatic apical periodontitis, and previously endodontic treated tooth based on radiographic examination. And at least one root has no lesion and not retreated. Healthy periodontal without mobility and no bleeding on probing, and also clinical intact margin of direct indirect caries or leakage, absence of sign of fracture. The exclusion criteria were follow: root canal retreatment of all canal, a vertical root fracture, and also surgical endodontic treatment had been performed previously in the root to be retreated. A total 1,545 subjects underwent root canal retreatment. 1,463 subjects did not meet the inclusion criteria. 82 multi-rooted teeth met the inclusion criteria were used for the tooth survival assessment. The non-endodontic failure were excluded from the outcome analysis. A total of 75 subjects with 75 teeth were eligible for outcome assessment and divided into two groups depending on the radiographic available at follow-up radiograph group and CBCT group. The study parameters were collected by one examiner. The patient-related parameters were follow: gender, age, location of the teeth. The outcome per root and per tooth were classified into favorable and unfavorable using clinical and radiographic criteria of healing. Treatment outcome of retreated root and treatment-related parameters such as quality of root filling, sealer extrusion, iatrogenic mishaps, and type of restoration. Also, the tooth survival recorded in the month. The result of this study: a total of 75 teeth in 75 subjects were available for outcome analysis. The favorable outcome per tooth was 86%. At follow-up, 92% of retreated root had favorable outcome. From untreated root, 3% showed radiographic sign of periapical lesion. No statistic difference was shown between outcome per root and per tooth between both groups. The survival rate at 12 to 48 months after retreatment was 91%. In conclusion, selective root canal retreatment is associated with favorable outcome in majority of the cases. Untreated rooted rarely developed radiographic sign of new periapical lesion at follow-up time. Thank you.